Thank you so much for joining us for this edition of All Angles. I'm Dion Jax-Miller. And coming up in the program, we're looking at the latest COVID-19 measures, their impact on entertainment, on small business, on public health, and on us. And later on in our All Angles Rewind, as we continue to celebrate 15 years of All Angles being on air, we're going back to one of our programs we did last year in the early days of the pandemic, listening to Jamaicans abroad speak about their devastating experiences with COVID-19. In this segment of the program, though, I'm joined by the public health experts. We have with us Dr. Johan White, immunologist and vaccine researcher. We also have with us Dr. Kevin Harvey, who is the head of the School of Public Health at the University of Technology, Jamaica. Gentlemen, thank you both so much. It's so great to have you both again.
Thanks for having me.
So here's the thing, and I'm sure you all know this, and I'm sure you're probably all feeling it as well. By now, we're tired of COVID, we're tired of restrictions, we're tired of measures, and the pandemic just seems to be going and going and going. Dr. Harvey, let me ask you first, where are we at this point in the pandemic? Where are we?
Well, what we have to understand, Dion, is that the pandemic is not going to disappear. It will become normalized later on as we accept and start to live with the virus. But COVID will always be with us for the foreseeable future. It's not going to go away. And as you have seen, from time to time, there are going to be new strains, like we have experienced with the flu viruses. And so what we have to understand is that we have to plan for the long term and not expect that we'll be able to vaccinate our way out or test our way out or lock down our way out of the pandemic. We cannot lock down and wait for it to go away because it will never go away.
Wow, Dr. White, let me bring you in on that, because I don't know, if we never knew it before, I guess that might be a little bit shocking to hear. It's not going away. We have to live with it.
Right. Yeah. You know, it's a race against time, and one of our most important action items will be the vaccination and getting that rolled out and have people access vaccination in time, because the longer that you take to vaccinate your population, the more opportunity is provided for new strains to develop. And new strains mean maybe existing vaccines may have a bigger challenge in terms of working against those additional strains. So far, the strains that are emerging, the vaccines that we have seem to cover that adequately, but the more opportunity you provide for strains to develop in that, if you delay vaccination for too long or we have trouble accessing and organizing to get vaccines, then that will put us into a bigger problem.
Well, let's put in perspective, because we heard yesterday the UK is sending us 300,000 doses tomorrow. Now, the latest figures we have, we're still at under 10% of the population fully vaccinated. So 300,000 doses would be another 10% of the population, approximately, getting one dose. So, Dr. Harvey, is this a game changer or no?
I mean, it won't make any significant difference. It is important for those who get the vaccine, and they will be safe from serious disease and death. But in terms of a national level, we will still be at risk until we get to a high enough level of vaccination, which we're seeing could be 70% or more of the population fully vaccinated before we can say that the entire population is protected. For us to get to 70% or more based on the current rate of vaccination, it's going to take us more than a year. So we have to plan for the long haul. We have to plan our measures so that we can have a degree of freedom while reducing the number of deaths. Our biggest limitation is really the hospital capacity, and that's what we have to track on a day-to-day basis. The way we're looking at the positivity rates and the number of tests and all of that is not really helping, but because the hospital rate is really our major limitation. If we were to test far wider, our positivity rate would drop. In fact, if we were to use the testing, the antigen testing in the private sector, if you look at today's testing numbers reported by the Ministry of Health, if you incorporated all the testing, then the positivity rate would be somewhere closer to 6% than 19%. But the positivity rate that is being reported only includes the PCR testing and the antigen testing in the public sector. Now, as you can imagine, that level of testing is representing a skewed number of hospital testing, symptomatic testing, and persons who are seeking help in the hospital system, so they're already ill. Those who are mildly ill, or those who are traveling, or others are testing in the private sector. So you can see where you're having maybe twice as many persons tested in the private sector now than in the public sector. This changed somewhere around in February, when the private sector was given the go-ahead to do testing, but those numbers are not incorporated in the positivity rates. Now, that is important. The rates that are the positivity rate is going up, so regardless of whether they include them or not. But we need to have more representative testing across the population. So you include the symptomatic, the asymptomatic, and all the persons, so you can get a better representation of what is happening in the country.
All right, I want to be clear on what you're saying. So you're saying, as it now stands, given the way in which we're testing, you don't think the positivity rate is an accurate reflection of what's happening across Jamaica? Would that be accurate?
Yes, because we are testing, but we are not, the positivity rate that is reported every day. If you look at the numbers today, 181, 19% positivity rate. The positivity rate is only a reflection of the PCR testing and the antigen testing in public health facilities.
Yeah.
The antigen testing in the private facilities is not incorporated in the positivity rate. So for example, 181 positives today, 2,700 tests, that is not 19%.
Okay, so your recommendation in relation to testing, what do you want to see us do?
Well, I think we need to roll out testing in a broader manner, make it more accessible across the country in every community, so that anyone who wants a test can get a test. The antigen test is useful and can be done easily in any physician's office. We need to approve additional kits. Right now, there's only one, really, or maybe two approved HIV antigen test kits available in Jamaica, and there are many others that are WHO approved that could be utilized as well. But we need to bring testing to a far greater scale. We need to be doing more like 10,000 tests rather than one.
Okay, got you. Dr. White?
In general, I'm in agreement with Dr. Harvey. I've never really paid much attention to the positivity rate.
What? And we're killing up ourselves every day, Dr. White. We're killing up ourselves. We're looking at positivity testing. We're saying the positivity rate and our blood pressure going up and down depending on what it is.
Right. To be honest, I totally ignore it. It's misleading. If the public health response had started out with strategic testing, you know that I'm going to test these 10 areas that I randomly selected from the Jamaican geography, and I'm going to go back and keep testing these areas and do it in a systematic and planned way, rather than just rolling out a vehicle and say, okay, I'm going to go do testing in 15. It's not the most effective use of resources. And then you end up with these misleading results, because you're only going to be able to report on what you're testing in terms of as far as your catchment area goes or your reach goes, and it's not really a reflection of what is happening in the community itself. So I've usually ignored it because I know that it's not informed by a planned sort of a systematic approach to testing. But more people do need access to testing. People with symptoms that have not been able to access testing in a timely manner, that has always been an issue. And I feel like we're back to the beginning of a pandemic. But, just take those numbers with a grain of salt, that, there is more happening out there than these numbers would reflect. And as Dr. Harvey indicated, that your positivity numbers are going to be reflecting what you're testing. And if you're not testing systematically and in a strategic way, then there's little information that you can garner from it.
Okay, so if you are going to revamp the testing process then, starting today, what would you change?
Sorry, not hearing you.
I'm sorry about that. I'm saying if you are going to change how we go about testing then, what would you change?
It needs to be planned. So you determine that if, for example, 14 parishes and you split it up into geographical areas and you say, I'm going to test these areas, determine a particular number that you're going to test for. And that's a representative sample. So you're not going to say, I'm just going to test people with the sniffles or with a fever or with the flu, because we know asymptomatic infection is a significant proportion of that. So you're not going to skew, as Dr. Harvey indicated, you're not going to skew your testing pool to just people coming to hospital or just people with symptoms. You want to know what's happening in the community. You can determine from certain calculations the number of people that you need to test. And if you do it in certain spots that you pre-selected and you go back to them maybe every other week or so, then you will have a number that is more reflective of what's happening in the community. And in fact, if you use that approach, you end up using fewer tests and you have a better use of your resources that is providing information that is more useful in terms of what's happening in the community.
Okay, hold that thought for me, doctor. I have to go to a break. Let me go to a break and come back. We'll continue this conversation. Remember our hashtag, it's TVJ, all angles, soon come.